Every day we have the ability to change someone's life. Don't ever waste it.
I am the Director of Nursing at Franciscan Health, and I am currently covering the ICUs, the EDs, the Family Birth Center, rehab, and the dialysis and ancillary services.
I've been here a little over 21 years. I started as a new grad in the Med-Surg unit in telemetry. I'm now the Director of Nursing. I have both Chicago Heights and Olympia Fields Med-Surg and the telemetry units. One of the things that was most attractive to me was the mission, the concern for the community, because I do live locally. And by offering services to my neighbors and friends is an advantage, because it gives me that opportunity to, again, serve them on a personal level.
The mission spreads not just to the patients, but I think concern for the employees and a genuine desire for their well-being, their families' well-beings, and they do that same thing with their patients. But one of the examples that sticks in my mind is a patient that had been homeless and was being returned to a shelter, and when they were discharged, they needed appropriate clothing. It was cold. And we do have clothing available here in the hospital, but this patient was a unique size, and the floor took up a collection, and they went out, not the whole floor, but one of the people went out on break and bought the patient appropriate clothing, including a coat, pants, warm sweaters, and shoes and socks, so that they would go into that shelter with appropriate clothing, and they would be warm and they would be clean. And that is going way above and beyond the norm. There is a great value put on continuing education, not just for state licensure reasons, but because it keeps the nurses current, and it gives them something to strive and something to grow in their career. The foundation at Franciscan Health has helped us greatly by getting a fund together that will encourage nurses to go back for specific certifications, so that they will now not have to bear the burden of paying for those certifications. They are not inexpensive, and they can apply, meet the criteria, and go for additional accreditation in oncology nursing, certain categories in ER. The ICU has special certifications. You can even get them for the medical surgical floors. And this will help hone their skills, recognize their abilities, and then increase their skills. I believe that giving to the foundation is giving to the community in the long run, because a donation to the foundation is always put back into Franciscan Health. It goes towards programs that benefit the community. And anything that can be done that enhances, whether it's the education level, services available, or a special project adopted by the hospital. Our mission is our community. Our patients are our community. So anything that can be done to enhance the growth of the foundation and support that is supporting the community. I'm Maureen, and this is Edna, and we are Franciscan.